All right, let's dive right in. Today, we're talking about something that's become incredibly common, but it often flies completely under the radar until things get serious. We're talking about non-alcoholic fatty liver disease, a condition that's quietly affecting millions of people.
So let's just start with this question. I mean, think about it. What if a pretty serious disease could be developing inside your body, a disease that can lead to major liver damage, but you feel absolutely fine? Well, that's pretty much the deal with non-alcoholic fatty liver disease, or NAFLD, and that's exactly why we need to talk about it.
So first things first, what exactly is a fatty liver? This is one of those things that's often discovered completely by accident. Maybe you're at the doctor for something totally unrelated and it just shows up. At its most basic level, NAFLD is what it sounds like. Your liver cells are storing way too much fat. But the most important part of that name is non-alcoholic. This isn't the kind of liver damage you get from drinking too much. Nope, this is all tied to your metabolism. Okay, and this is really important to get. NAFLD isn't just one thing. It's a whole spectrum. You see, it starts off pretty simple, which is some extra fat in the liver. That's reversible. But if you don't do anything about it, it can progress to NASH, where you've got inflammation and actual damage to the liver cells. From there, scar tissue starts to form. That's fibrosis. And the final stage, cirrhosis. That's severe scarring, and it's often permanent. So, here's the thing you absolutely have to understand. A fatty liver isn't just a liver issue. Think of it more like a bright, flashing warning light on your body's dashboard. It's telling you something bigger is going on with your overall metabolic health. I mean, just look at this list. NAFLD is so tangled up with these other conditions that some doctors call it the liver version of metabolic syndrome. If you're dealing with things like insulin resistance, high blood pressure, or type 2 diabetes, there's a really good chance your liver is feeling the heat. It's all part of the same big picture. So the bottom line is this. Don't think of the fat in your liver as the main problem. Think of it as a symptom of a much wider metabolic storm that's brewing throughout your entire body. All right, so if your liver's in trouble, you'd probably think the biggest risk is, well, liver failure, right? But what if the number one danger is actually hiding in plain sight somewhere else entirely? And boom, here's the answer. For a lot of people, this is a real shocker. The leading cause of death for people with NAFLD isn't their liver giving out. It's heart disease. That same metabolic dysfunction that's packing fat into your liver, it's also putting a massive strain on your heart and your blood vessels. Okay, so that leads us to a huge challenge, right? How in the world do you find a disease that's basically designed to be invisible in its early stages? Well, this is where being aware becomes our single best weapon. Since you can't just wait around to feel sick, you have to look at the risk factors. If you're in any of these groups, especially if you have type 2 diabetes or metabolic syndrome, that's a huge sign that you should probably be screened for NAFLD. Finding it early is what gives you the power to actually do something about it. So how do doctors even find this? Well, it usually starts with basic stuff, like blood tests that check your liver enzymes or maybe an ultrasound. But, and this is a really important but, you can have perfectly normal liver enzymes and still have a lot of fat in your liver. These tests are just clues. They're not the final word. Okay, we've laid out the problem, we've talked about the risks. Now for the most important part. What can we actually do about it? Let's open up the toolkit for getting your liver health back on track. And this, right here, might be the most empowering thing you'll hear today. While there's no magic pill for NAFL just yet, the single most powerful treatment is 100% in your hands. The absolute cornerstone of managing and even reversing this disease is lifestyle. So what does that look like? Let's start with a number. A sustained weight loss of just 7 to 10% of your body weight. That's it. That small amount can be enough to dramatically slash the fat in your liver, calm down that inflammation, and sometimes even start to reverse the scarring. Next up, your diet. And no, this isn't about some crazy restrictive plan. All the evidence points to a Mediterranean way of eating. We're talking lots of whole foods, healthy fats, lean protein, and, at the same time, cutting way back on refined carbs and added sugars, especially the ones you drink. It's all about food quality. And the final piece of our core toolkit, you guessed it, it's another number, 150. That's how many minutes of moderate exercise you should aim for every week. Think a brisk walk, a bike ride, going for a swim, anything that gets your heart rate up a bit. And get this part is just incredible. The power of exercise is that it helps your body use insulin better and it reduces liver fat all on its own, even if you don't lose a single pound. That means every single walk, every workout, it all counts, even if the number on the scale isn't changing.
So, as we bring this all together, it's pretty clear we need a totally different way of thinking about this. A fatty liver isn't just some random thing a radiologist notes on an ultrasound. It is so much more than that.
This quote right here, it just nails it. A fatty liver is a direct message from your body. It's a warning sign that your metabolism is under serious strain, and it's giving you a heads up before bigger problems like heart disease or cirrhosis have a chance to take hold. So let's just hammer home the key takeaways one more time. NAFLD is a silent but serious condition that's about your whole metabolism. Its biggest threat, for most people, is actually heart disease. Your lifestyle is, by far, the most powerful medicine you have, and catching it early gives you that all-important window to take action and turn things around. And all of this leaves us with one final big question for you to think about. Is your liver acting as a silent sentinel, a guardian, giving you an early warning about your health? Or is it becoming a silent victim of a process that you have the power to change? In so many ways, that choice is up to us.